You're now recording.
All right.
You want to stop the recording?
Yeah.
Or just let it run?
We can just let it.
Gloria, you were coming. I'm coming, said you were coming. He was coming.
Hello, Neil. Hello, Sarah. Welcome.
If anybody wants to see what I've been doing on my vacation, to some front and off. And look at the nursery, which is now all the walls are painted.
Well done.
We just have to do the trim. But
Great.
I'm tired of painting. Not that fun a job.
Yes, it's good work.
Boy, you know.
Hi, Lisa. Oh, won't do that. I'm going to use the chat.
There's Kelly.
Kelly? Where's Kelly? Oh, there he is. What's he doing?
Watching, maybe even participating.
Does he see you, Doug? Yes, hang on.
I'm just here lurking. Just here lurking in the background.
Muted. Hello, Kelly. Can you hear me? Would you please unmute and say something so I can see if the sound is working in the room?
Absolutely. How's that? It's good to see
How
you.
about that, huh?
Actually, I don't see you, but I
I'm
do
impressed.
hear you. Well
Okay.
done. Well done.
Thank you, Kelly. It's all working. We're ready to go.
Great.
Whoops. Ah. All right. Well, welcome everybody to St. Dunstan's Church, to our Sunday school classroom, and we have a mixture of people here from the feeding program and from the severe weather emergency shelter. And thank you all for doing those things. Those are, it's just really wonderful that you're doing them. And I'm just super grateful that we all get to work together on this. And tonight, we're going to have a very brief, compacted training on conflict de-escalation. And since we just brought our feeding program back inside after a few years of pandemic handing food out at the door, I thought this would be a good time for our crew to do it along with you. So here we are, and I'm just delighted that you're here. If you need anything, I can help you with it. There are bathrooms in the hallway right there, a boys' room and a girls' room, built in 1962. And anyway, if you need anything at all, just let me know too. So Celia, do you want to introduce our speaker? And
Sure, yes. So my name is Celia Sodal, and I'm with NUHSA, the North Urban Human Services Alliance, and we are so lucky to be able to partner.
Your microphone's off, Celia.
Well, her microphone has to be off, so she'll have to move closer to the other machine.
I can turn this microphone off and you turn yours on.
That would work.
That would work. So.
All right. No.
I think David would have to disconnect audio.
I see why the microphone was off.
Yep. Yep.
Again.
Okay, I did.
Okay.
All right. Hi. So NUHSA, we're so grateful to St. Dunstan's Church and to Reverend Marshall to be able to partner with the city and with the church to have the shelter here. And this shelter also wouldn't happen without our volunteers who stay overnight and make it possible to bring in people on cold nights. So thank you for letting us be here, and thank you for being a part of this to make it happen. I'm going to send around a sheet, and if you write your name and email address, I will send you the PowerPoint that she's going to put up on the screen, and there's lots of good information on there. She won't be able to cover it all tonight, but that way you'll have the information, and that also has her contact information in case you want to follow up with her and ask questions later. So thank you.
Hi, everybody. I'm very happy and honored to be here tonight, providing training. Thank you for the job you are doing, the volunteer job. This winter shelter and the lunch, serving the lunch. Those will be resources we are going to provide. I am a part of the Radar program. It's written there under my name. My name is Svetlana. Our Radar program is covering 5 police departments in Shoreline, Kenmore, Lake Forest, Kirkland, and Bottle. And when we respond to 911 calls with the police and follow up with people, we provide resources, and I'm going to, provide the information about the winter shelter and the lunch to some people in need. So thank you again for your for volunteering for that. I'm going to stand up. This is the usual way I'm providing trainings. If you feel uncomfortable that I'm standing up, you can just tell me. You can stop me anytime if you have any questions or you want to clarify something. I'm going to go really fast through this presentation. It's a lot of information, but we don't have enough time, and you don't need to remember all of the details. However, if I'm looking at my watch, it's just to manage my time better through the parts of the training, not because I'm looking to get out of here. So Just a few words about me. I'm a licensed mental health professional here in Washington State. I have more than 25 years of experience in mental health area, starting as a psychologist in Bulgaria, in the community, then in Bulgarian Air Forces. Then I moved here. I worked in a security area first. Then I worked for the military, all branches, providing in all my jobs, like all kind of psychological services like assessments, evaluations, treatments, crisis intervention. Then after doing some job for the military, I moved to Monroe Prison. You probably heard about the Monroe Prison and their psychiatric facility, special offender unit, where I was for a while psychotherapist and supervisor, providing services for the most severely mentally ill offenders in our state. And then I moved to this full-time job with the police departments. So that's about me. So let's start, because we have really very short time to go through a lot of stuff. But again, you can stop me anytime. You can ask me a question. You can ask me to clarify. And since I'm going to try to speak fast to go through the presentation, and as you can see, I speak with my accent is strong. If you don't understand something, please stop me. Please ask me to repeat. Don't hesitate.
I clicked on it, I'm sorry.
Okay,
Yeah,
that's okay. So as you all already heard, this training is about de-escalation, de-escalating angry people, people in crisis, people in mental health crisis, people that seems getting in a conflict situation with you, but it doesn't need to go to a conflict between you and the person. That's why you're going to learn some basic de-escalation skills to use them. During this training, you will get better understanding of what's crisis, what mental health crisis, and escalation, recognizing the signs of escalation and warning signs of possible violent behavior, because there is a difference between aggressive behavior and violent behavior, right? And I'm pretty sure that all of you have some kind of knowledge in the area, and it will be just like a refreshment part of the training. Will just refresh your memory about some stuff. You'll have better understanding about the stress response and anger, because anger is in the base of the stress response and something that the Mother Nature put as a natural mechanism. We'll talk a little bit about this, so you will get this better understanding about the anger, not just like a behavior that we see and we deal with, but that it has something more to it that is on a very basic nature level. You will recognizing most common mental health symptoms. I'm going to talk about some basic psychotic symptoms and mood symptoms that usually you'll see involved in crisis situations. And we'll be talking about basic de-escalation strategies in your volunteer role for approaching agitated person, person in crisis, person in mental health crisis, and reducing this possibility, this likelihood of violent outcome or escalation of this crisis. So there are many ways to define de-escalation, but the basic definition is it's a reduction of intensity of conflict or potential violent situation. It's a human behavior that is intended to prevent escalation of a conflict, a method used to diffuse the situation with the potential threat of violent behavior. And when we are talking about de-escalation, there are verbal de-escalation tactics, there are physical de-escalation. You are volunteers, you are not required to use, to be trained in control and de-escalation. You'll be learning some basic verbal de-escalation skills here. But I want to say, even with verbal de-escalation, your role does not require you to be experts. You'll be just trying your best, depending of the circumstances. And I want to tell you and you to remember this, even if you are very well trained, even if you are expert in this de-escalation, there are always situations that you cannot manage to de-escalate the person. And this happened to me sometimes in the prison when we had people in crisis and in mental health crisis, and me or some of my colleagues trying to de-escalate them. When it doesn't work, it doesn't. So, or negotiation team comes, they try, and they still need to use force because the person is so to the point out of control that they nothing helps. So if someday you have a situation and you remember something from the training, or you have skills, you have already have skills and you are using them, and I'm sure that through your volunteer job you use some of them many times, right? But if nothing's worked, don't feel that you did something wrong or you didn't do something the way it's supposed to be done. As I said, you will always have the situations where it just doesn't work. And the other thing to remember, without specialized training, we should never consider to use physical force to control the person. But if the de-escalation is not working, the verbal de-escalation, and they suddenly attack you, you need to defend yourself the way you can. You don't have this training in physical tactics, but you need to defend yourself the way you can at the moment. So, which means that the verbal de-escalation does not exclude the need of using for you to defend physically, to defend yourself, if this de-escalation is not working at the moment. So, let's see. Oh, it's not moving. Okay. So let's go. Before we get to this part, anger, aggression, and violation, let's just remind ourselves when we are in a normal situation of disagreement or conflict with someone, but it's not they do not show any signs of crisis or escalating to the point of anger and continuing escalating. There are different strategies that we use, and those strategies are conflict resolution strategies. However, you all know about avoiding, compromising, accommodating, collaborating, right? But usually we use those strategies when we disagree about something between us. You know, there's disagreement, or with partners, or with a client. But as I said, the client is not in a crisis situation. They unfortunately do not work during the crisis. So the de-escalation techniques are a bit different. Now we are going to talk about what's anger, what's aggression, what's violence. Anger is a basic human emotion that is very closely tied to the survival mechanism. And we are going to talk about this to the jumped.
You're going forward.
Oh, sorry. Yeah. So it is tied to the survival mechanism. And I'll leave you read those slides, the rest of the slides and the definitions later. We don't need to go word by word through them. Aggression is a hostile, violent behavior and attitudes toward other people, and it could be a verbal aggression, it could be physical aggression, right? But when we talk about violence, violence is something that goes over. It's the difference is between the anger and the violence is in the intensity and the behavior that they show, right? Before a person go to anger, they to violence, they go through another stage that is rage, and we are going to talk about this a little bit later. So as a basic response mechanism, anger is tied to this fight or flight reaction, stress reaction. You've all heard about fight or flight, right? When we get through a stressful situation, and it's a kind of intense distress situation, it usually activates a part of our brain, a limbic system. You don't need to remember those stuff, but just I put some more information in those slides. So, and I'm going to explain a little bit how this mechanism works, because anger is part of the fight reaction to the stress. We all go through stress, but the stress is not always life-threatening. However, this fight, flight, freeze, fawn mechanism was put in our brain by God or Mother Nature, whatever you like to say it, to help us survive. So when there is a danger, when the body receives signals that there's danger, this system activates, and the system is called limbic system. And some like you can see it as in some articles like a child brain or reptilian brain, part of the brain. So when our body thinks that we are in danger and this danger is life-threatening, this system starts like ringing, danger, 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 and the hypothalamus part of the brain releases adrenaline, and the adrenal cortex releases another hormone, which is cortisol. So just imagine this dump of the hormones, the two hormones in your body, they actually prepared the body to fight and to survive. And this is what can trigger this emotion, the anger. And if we get into this state of fight, some people do not, but some people get. So the anger is pretty close and related to the response of our body to life-threatening situations. Something to add here. Some people, for different reasons, like difficult childhood trauma based on constant abuse, or mental health illness, or other reasons, may in situations like this,
this limbic system can be activated even if there is no life-threatening danger around the people. It's just the signals that are coming to our body and the way those people perceive them. Excuse me.
Yeah,
Please.
of course you want.
I'm so sorry. They perceive it as a threat, and they activate the system that constantly is giving them this sign of danger, 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 and they're reacting with those kind of responses, not because there's really life-threatening situation around them, but because the limbic system becomes at some point a driver of our brain instead of the cortex. Cortex is responsible for us thinking, making decisions, assessing the situation. When this limbic system takes over, whatever is the reason, then the cortex is not dictating our behavior, and we can become really impulsive and reactive and go straight to those responses. So when you see a person that is angry, it may not necessarily mean that they're jerks or, doing this for because they have their characters like this, but they may actually experiencing this activation of the limbic system that takes over, and their reactions are just very impulsive. Let's talk now a little bit about anger. So on the left side, you can see the cycle of acting out. Thank you so much. Sorry again. Usually, we are calm. We are not people. There's no person that can be 24/7 in an angry or state, or people are usually calm, and then something can trigger a reaction in them. Something can trigger this stress in them. Doesn't matter if it's a very, very little stress, they can perceive it as something really big. And the reasons could be so many reasons, right? And then after the stress is triggered, people can get irritated, agitated, and then go to an anger phase, anger state, and from anger to rage. If you see the thermometer, there is a rage state, and on the top would be the violence. So they may not go to the rage and to the violence. They may stop themselves and start calming down. We'll talk a little bit about this later, but they may have some inhibitors, like they may have some values in mind. They may think about the consequences at some moment, and they can stop. If they don't, however, they can go into the rage state, which means the de-escalation is going up and up and up. And the difference between anger and rage is in the intensity of the emotion and the feeling. And we'll talk a little bit about anger and rage and some examples later. The anger, if we can imagine that this thermometer has from 0 to 100 degree of intensity. 0 will be totally calm. 100 will be the violent, the moment they attack and they do something or start throwing stuff, start hitting the wall. Between 95 and 100 would be the rage, and up to 95% is the anger. Someone, it can go from, let's say, 40 or 50 to 95, gradually going and escalating. But between 95 and 99, it's the rage state. Again, when the stress response system is not working properly, people can escalate really fast. It can happen very gradually for some of them. Some of them can escalate really fast, especially if there are other factors like maybe some mental health symptoms that are kicking and they're struggling and cannot manage, or some medical conditions or influence of substance or something else. They can really rapidly escalate this cycle, and they can go to a state of anger within a minute, or even sometimes you can see the change of the mood in seconds, going up and up and up. Let's talk now. What are the main causes of escalation? We are all human beings, right? We can all get angry. I get angry sometimes, and that's okay. What is not okay is to act and to put your anger on other people, right? And to show a behavior that threatens other people or yourself. However, when this cortex takes over, all of us, when we get angry, we can manage our behavior. But what can cause escalation of the anger? So I put a lot of stuff here. Let's start talking about them. People can feel threatened and afraid. They could be paranoid at the moment. They could be delusional. They could be, they may have PTSD, and they can feel threatened by the environment or by the people around. The environment and the people around may not pose any threat to them, but this is the way that they think and they perceive the situation. Another reason for people to de-escalate, to escalate, when you are interacting with them, is if they feel disrespected or attacked. And again, you may be very kind to them in some situations and very respectful, and you say something that is still respectful, but for some reason they just go from 40 degree to 80 degree because they felt that a particular word sounded to them disrespectful, or they felt that they are criticized or attacked somehow by your statement. So this is another reason they can escalate, and they can escalate really, some people, rapidly because of this. People may feel unwanted and rejected, and a lot of people that experience childhood trauma are constantly actually having this feeling of being rejected and unwanted. And people with some personality disorders like borderline, but you don't need to kind of learn all this about the disorders or diagnose people. I'm just giving you, this basic information. People can get escalated because they feel unwanted, minimized and invalidated, or triggered by something and overwhelmed. It could be mental health symptoms, could be hallucination, could be loud noise, could be lots of people around moving, could be a messy situation around them, or if they feel the environment not structured enough for them, they can feel triggered and overwhelmed, or they can feel ignored, not listened to when you are in a conversation with them. They can feel that you don't keep enough attention to them, and they can escalate because when person is angry, they want to communicate, but they're not interested of what you are saying. All they are interested in is to tell you what they want to say and what they feel at the moment. So again, angry person is communicated and trying to communicate with you, but not to hear you. They want to be heard, and that's all they care about, to be heard, period. If you're trying to explain your point, we'll get through this later, it may cause more escalation because you don't keep enough attention to them. Or let's say you are serving lunch and the person is trying to talk to you, but there's another person waiting and they want to get their food, and you move your, you look at the other person, you just pass them, and you're back to the person that is talking to you, but they're already angry. Why? Because you moved your attention and they feel like they were ignored and they were not listened to. People escalate when they feel lack of choice or loss of choice. So we are going to go later into some techniques. So I'm not going to talk about this right now, but it's good if they feel that they have a choice and you can give them a choice through some verbal statements. Lack of personal power. Again, people especially who went through complex trauma are very sensitive, and they feel they don't have power. They feel usually like failures. You don't. You probably will never know, or unless they mention something to you that they were abused as children. But whenever you have situation when someone is escalating, you can remember how many things could be causing this, and maybe this will remind you that we use empathy to people, because we really don't know what stays at the bottom of what we see on the surface as a reaction, what was their life, what they went through, what they're going through right now. Feeling unfairly treated. Very often you can see that, especially with people with personality disorders, they always think they're unfairly treated. And people with trauma, again. Sometimes people with neuropsychological disorders, we'll get to this a little bit later. Feeling discriminated, feeling out of control, stress and anxiety, traumatic experience, already mentioned it. People that are experiencing physical pain at the moment due to some medical condition, or they just accidentally hurt themselves or whatever causing this physical pain, they may not have this intent to escalate the situation, but it may go just because they feel physical pain and they can feel this discomfort or emotional pain. Something's going on in their life right now. They just broke with someone that was important for them. It's an emotional storm inside of them going on. So this is emotional pain that also can escalate, and what you are saying may have nothing to do with their escalation. Frustration, some people using the escalation as coping mechanism because they have not learned anything better how to cope. Usually when we are kids and our parents and if we grew up in a totally balanced family and our parents are loving and they teach us how to deal with every kind of stress and give us those skills, then it's easy. But when we don't have, we have not learned all different ways to cope with stress, and then we may use escalation as coping mechanism. It's you can see it displays anger in projection, but you don't need to kind of remember all those kind of stuff. They may have mental illness. We mentioned this, intellectual disability, the physical environment. I mentioned this already, and what else can escalate people? The people that are around. Just imagine a situation in a shelter. Someone is kind of nervous and starting arguing you, and people listen around and they started telling the other person, oh, he was so disrespectful. He said that to you. Are you going just to let it go? Right? They can start amping up the people. I don't know if this happened in the shelters, but in prison, based on my experience, very often if the person, even if they are in their cell, their neighbors can hear and they start amping them up by giving them some, advice. Oh, do this, do that. Oh, she said this. Did you hear how did she say it? She's disrespectful to you. Are you going really to listen to her? And stuff like this. And then influence of substance. Can you think about anything else and add it? Okay.
I feel what I've seen a lot is it's kind of up there, I think, in lack of personal power, lack of choice is the main thing I see in kind of conflict out in the feeding program is where people feel like somebody's invaded their space.
Oh yeah,
that's the main.
Very good point. Thank you so much. Yeah, it could be here. See, I forgot to put it, but invasion of the space is another thing. And I will actually go back and ask you to tell me, how do you know that someone is aggressive at the moment? What are the signs of aggression? What do you see?
They yell.
Yes, they yell. What else?
Noise and space. So they get close.
Yes, they may start getting closer. What else?
Moving their arms around or
Gesturing. Yeah, they may gesturing.
Facial expression, anger on their face.
Yeah, their
really
facial
getting
expression, they may clench jaw, this, there is a body language and verbal language that shows you that this person is angry. So they'll be anxious, irritable, they can show agitation, mood swings. And we'll talk a little bit later about the mood symptoms, but you can see rapid changes in their mood at the moment. Also, poor judgments, right? They cannot make good decisions at the moment. Signs of fear. You can see someone that they're terrified or they just fear. May not be necessarily terrified, but they're afraid of something, of you, of something else. Poor concentration or attention. Some of them may not be able to keep attention. You may talk to them, but they're distracted. Also, personality changes. If you have clients that come often to the shelter or to the church for lunch, you know their baseline behavior, right? And suddenly you see some changes. It may show you that they may be in a state of aggressive, like at the moment. Cognitive distortions. Those are the cognitive distortions. People show cognitive distortion when they perceive the situation differently, and there are different distortions that they can show, but more basics are black and white thinking, all or nothing thinking. Yeah, you are either my friend or my enemy. You are either with what I'm saying or you're my enemy. It could be judgmental thinking, emotional reasoning, catastrophizing. But so overall, the distort thinking is always something very negative, something about the worst case scenario, something that happens to them or will happen to them. So when you see this, this also can show that they're at least warming up to this point of.
You could also add on like repetitive.
Yes.
Because I've seen very repetitive thinking.
Yes.
Where they are hyper focused on a issue and will repeat it over and over again.
Yes. They're preoccupied with
in-
something. Yes. Very good point. And so as verbal signs, you can see abusive language, provocative language, because when someone is amping up and they are getting more and more, in this state of mind that they are getting more angry and more aggressive, they may start provoking you, so they have an excuse to do something, right? And you'll see the body language. We already mentioned most of them. Muscle tension, clenching jaws, hands. You can see them moving, gesturing. You can see the change of the color of their face. They can suddenly get really red, or something suddenly can get pale if they are red, because when the stress hormones are released in the body, what happens? They are in the bloodstream and the blood pressure is going up and the face become red, and they're yelling and doing something. If they suddenly like stop and they get pale, very often it's a pretty good sign that they're about to attack. So this is something that you need to be aware of. And yeah, right before the attack, they increase the trespassing of your space. They may try to find an angle to attack you, right? The angle that they think can attack you. Their face may start flashing. The face expression can change. As I said, they suddenly can stop doing faces, and you may see them suddenly staring at you or looking throughout you like you are not there. You can see displacement activity like hitting kicking. I'm not saying that when they hit and kick, they will always go to the next stage and they will attack somebody. Sometimes it's just release the pressure of them, but this usually happens with people that that think about the consequences and are not to the point of the rage. Once they get to the point of the rage, it's very, very difficult for them to control themselves from this point. It's still, you may still have a chance to giving them some instructions, and we are going to talk to this just a little bit, like controlling tactics, verbal, not physical, again, and it may work, but it may not. So if they hit the wall or kick, it doesn't mean they'll just stop to this point and they will not do anything else. They are just releasing the tension. It's not always the case. It may be a sign that they're going to attack really after that, and suddenly they may become calm. Because they are different expressions of the rage, I will spend a couple of more minutes talking about that. If we go back to the thermometer and the range state, you can see different signs of the rage. People may become chaotic. Let's say they have hallucinations and they see stuff around and they hear voices and you are around them and there are other people around, and this may create a chaotic feeling in them and huge confusion. So they don't know where to look and how to defend, from where to defend themselves, right? Because you are a threat, those people there are a threat, there's something that they see that it's not there, but it's a threat. They hear voices and they may start like doing very chaotic movements around and just yelling or talking nonsense. You'll see this disorganized behavior and talk. And then you can see some more like rage that looks different, not chaotic, but still very hot. And people will maybe be preoccupied and repeating the same thing and yelling and demanding and going forward and stepping more and more in your personal space. Or you may see some people that are basically predators, that they may not show any of those signs. They may not yell at you. They will just kind of study you quietly, and then they may suddenly attack you. I don't want to scare you.
No,
Too late.
advance warning.
Too late.
But you will see other signs. They still will say something. They may try to provoke you to kind of explore what will happen. So, and not everybody who is quiet around, right? But I'll give you a brief example. When I was in prison, I had a patient. He had a severe mental illness, and when he was not medicated and escalating, he was in some sessions he was yelling at me because he was upset with me that I decided to put him on involuntary medication. But he never attacked me, and he was yelling and using abusive language, and I was the worst of the worst. But with his peers, he didn't yell, and he suddenly was attacking a person that didn't do anything to them. So he was acting as a predator. just having his plan, what to do, where to do, waiting for the exact moment when this person has no idea that they will be attacked and doing it. So you may see really different signs of this, but most important are those stuff that you can see before the attack, and keep them in mind. If you see them doing this, just move yourself in like to the exit, or somewhere that you have a barrier between you and the person, and be ready to defend yourself. So let's talk a little bit about crisis and mental health crisis. Crisis is a short-term, overwhelming. We all go through some crisis in our life. It doesn't necessarily mean that we will escalate to really big crisis. We will use coping, usually skills and problem-solving stuff. However, crisis is frustrating thing, and some people cannot take this frustration. They can go further and escalate, right? And people diagnosed with mental health illness are at greater risk of experiencing crisis. But too often the crisis actually occurs before the mental health illness symptoms start showing up. And people that are mentally ill are not necessarily really aggressive people. They actually, some of them are pretty vulnerable and become victims of violence themselves. So just because someone, if you know, or if someone is showing signs of mental health illness, it doesn't necessarily mean that they will escalate, they will be aggressive, or if they are angry, they will escalate further and they will do something to put other people in a danger of being hurt. To effectively calm a person in crisis, known as a crisis de-escalation or intervention, require people to have a set of skills. The de-escalation, as we mentioned at the very beginning, can reduce the, the necessity of use of force. But again, you are not required to have like a really set of very high professional skills and use them, but whatever at the moment you think could be helpful, you can use it. Mental health crisis is a situation when person actions, feelings, and behavior can lead them to hurting themselves or others, or put them in greater risk of in their well-being of greater risk. Mental health emergency is something that is life-threatening, and we are going to talk a little bit about them. So when you recognize of mental health,
And maybe we could jump to, I'm just looking at the time, and
Yeah.
some people have to go upstairs to actually be in the shelter. Could we jump to the skills piece?
yeah, I'll go to the skills, and whoever stays till the end of the presentation, we can go through mental health symptoms and how you can recognize that someone is hallucinating or someone is delusional. So okay. Oh, sorry, I'm going ahead again. Okay. So when we talk about de-escalation, as I said, we can use verbal skills, and you will be using mostly verbal skills, right? Not any kind of control, physical control tactics. There are different models of, sorry, I'm still going back and forth. But one of the models that usually is used is the behavior change stairway model that includes active listening, empathy, rapport, influence, and behavioral change. However, some of those steps like empathy and rapport may not work with people with particular mental health symptoms, and I'm going to talk a little bit later about that. However, I don't believe that I need to explain to all of you what active listening means, what showing empathy. I'm pretty sure that you are using this every day in your life and in your volunteer job, right? So, and probably most of you have already seen this model, but let's go to some point of the active listening. What active listening means? You ask open-ended questions, and later you can read the slides. There's a lot of information to the slides. Because if you ask them only questions with yes or no, you cannot gather enough information. You need to give them a chance to tell what they want to tell you. You use minimal encouragement, like you can knock your head, okay. But just to tell them that you keep attention and you hear them. Paraphrasing, mirroring. So in situation when the escalation goes and goes faster, you probably won't have any time for mirroring, but paraphrasing is a good strategy. You just use your own words when they say something. You just, what I hear, what I understand. If I understand correctly, you're telling me this and that, right? And then emotional labeling means we just, you validate and you label the feelings that you see that they're showing, the emotion. You can say, it seems you are very stressed at the moment. So you are labeling, you may say, I can see you're frustrated and I want to hear a little bit more about what's going on. You can summarize, but you can use all those tactics at the very beginning when the anger starts. When people are to the point of rage, actually you will use less and less of those and more of other tactics. But during the conversation, in order to de-escalate them, to calm them down, you can summarize their statement. So this way, again, you show them they are effectively communicating with you, and they are you are listening to them, and you understand. So they pass the information then that they wanted to pass to you successfully. That's why we summarize, to show them that they successfully pass the information they wanted to. Otherwise, they will keep feeling like you are not understanding what they're saying, or you are ignoring them, or they are not successful in the communication, and this will escalate them. Statements like, I want to know what happened more. You may encourage them to talk a little bit. When people are over talking, we'll get there. You need to actually try and redirect them, but sometimes you need to know more. First of all, to give them time to vent, or to give them time to talk a little bit and get it out, to understand better what's going on with them. And then also to show them that you're keeping attention, and you are not ignoring them.
So I experienced what Carol mentioned earlier with the woman that said, you're too close to me, and she backed up, and I backed up, and
Yeah.
I don't know what you say to that. I said, I'm sorry, and turned around and walked away. That was the end of the interaction, but she was clearly very agitated, walked away, and none of those things seemed like the right thing to say. Is it
Yeah.
okay to say, I'm sorry? Is that appropriate?
If you want to walk away and say, I'm sorry, just,
And give her space?
yeah, and give her a space, that's okay. That's okay. Go with your intuition. If you don't feel comfortable in the situation, do whatever you think you feel you need to do and walk away, including and say, I'm sorry, I can't talk to you right now. And
Well, I
just,
didn't get the sense she wanted to engage in conversation either.
yeah, and maybe, yeah, this will be, yeah, you can totally do that. Again, trust your intuition, what your intuition says at the moment. You may feel the danger, you may not necessarily process the signs and say in your head, oh, I see this and that, and probably they're getting dangerous, but you kind of feel it, your body will feel something, you feel something that tells you, just get away from here and do it. If you feel it, just do it. Don't ask why questions, because they may irritate the person very much. Instead, you can say, I want to hear more about that, what happens, or something like this. But sometimes why questions may be really may escalate them. Don't give advice, don't patronize, don't make fun of something that they said, because they may take it really very personal. They may not understand the humor. Don't preach like you shouldn't. Give them quick reassurance. Don't give them this quick reassurance, everything's going to be okay. No, maybe nothing will be okay for them, and you cannot just say this, because next moment when their demands are not met, it's not okay for them, and it will escalate, and they will find you guilty for that things you promised them it will going to be okay, but then, so don't interrupt, don't cut them. When they talk to you again, they want to be heard. They are not interested in problem, to solve their problem. If they're angry, they're not interested in any problem solving at the moment. When you de-escalate them, then you can discuss eventually something, but not before that. Yeah, go ahead.
So the question, is it appropriate to ask, what can I do for you?
Yes, or what
I mean,
what is usually helpful for you to,
back to your question about not being able to meet your expectations for part of you. Like everything's gonna be okay.
Yeah.
What can I do for you?
Yeah.
That don't open up the environment, but then asking a question that you really can't do, obviously. It could.
yeah.
I mean, I'm just wondering about, is that?
What do you
appropriate?
think would be helpful? Do you think, yeah, I can help you with something, what is it? And you may clarify for them, this I can do, this I cannot do. I can do this, but I cannot do this. Let's, we have like 25 more minutes, right?
About 20 minutes.
About 20 minutes. Also be very thoughtful about your body language, because as you see, the body language plays 55% of the communication goes through the body language. And they say that 93% of the communication is non-verbal. So let's go further. Before you interact with people in your volunteer job, make sure that you are taking care of yourself, because in order to more successfully manage a situation that is a crisis for someone or help them de-escalate, you need to be prepared for that, and you need to be this on this level of self-care and resilience yourself. Otherwise, if you are exhausted, if you are overwhelmed, what's going to happen? You'll be kind of maybe starting getting triggered toward that direction that would be not very helpful for you or for the person that you are interacting with. Know your limits. Know what you can manage and what you cannot manage, and that's okay. I have my limits, and I know in what situations I would rather let someone else step in and give them a sign, or I'll just try to finish the interaction safely for me and the other person and walk away, just like you did. So know your limitation, know your buttons, know what can make you irritable and what make you explode or like verbally explode. We all have buttons, and if you are aware, don't take anything personal and be thoughtful about, because some of them can really try to provoke you so they can have an excuse to attack you, right? Or do something else to break something and destroy property. And they'll say it's your fault because you did this or you said that. In practice, whenever you have in any life situation, you can practice so you can feel more prepared when you are here in this role. And then other de-escalation tips, generally speaking, maintain your safety when you are in the church, in the shelter, when you are providing those services. Be aware, constantly aware of your environment, what's around, what's happening around. Are there any triggers that can trigger people? Like, I don't know, noisy, something else going on, maybe the electricity goes off, I don't know, something, and people can get scared because some of them may have mental issues and stuff. So be aware what's going on around. Manage the environment, identify exits, escape routes. Always make sure when you are interacting with someone, and especially when you see signs of irritability and getting further with escalation, to have an exit. And if there's, in some situation, if you don't have really exit, make sure that there are something between you and the person that can be a barrier. Then make sure that around you there are no dangerous objects that they can grab and hurt you with that or hurt themselves. Be aware of the people around. People are getting lunch together, or they're doing some activities in the shelter, and someone escalates and start arguing with you. Be aware while you are keeping attention with them, what's going on with the others. As I said, they can start amping up or just gesturing to them and still escalate them. So if you need to remove this person away from the peers, if you have this opportunity, just do this, because it's better to be you and the person instead of more people that can escalate the situation. Be calm. That for you to remain calm in any circumstances is like the skill number one, I would say. Remain calm even if you feel a little bit nervous. That's why you need to be resilient and to use more and more coping skills in your life, so you can be more prepared to stay calm. Be aware of your breathing. When a person is nervous, or how do they breathe? you can hear the breathing, or when they are angry, right? When a person is calm, can you hear their breathing? No. So be aware, and if you feel that your breathing is getting like a little bit more noisy, or try to breathe through your stomach and slowly and make it quiet, so the other person, because even if they are not experts in the body language, they just can feel it, right? And not to mention the predators, they will read your body language and they will know. So you need to be absolutely calm. On the other side, when the person is nervous and anxious, if you are not calm, how are you expected to calm them down? Call 911, walk away, call 911 if you are in an imminent danger. If you need to call 911, try, if you have opportunity to do it, not in front of the person, please just move away, or give like some kind of keyword or sign to your colleagues to call 911. Because if you do this in front of the person, you may actually escalate them further. They may attack you. If let's say you have a situation, someone, you called 911, the police is coming, be aware that at the moment, even the person is still in the anger stage, but not in rage, they can suddenly escalate further just because they are seeing this authority, police. And recently people have more like negative attitude toward the police, and just might escalate them. So before the police arrive, make sure that you have an exit, or you are ready to kind of defend yourself. I'm not saying those are the worst case scenario that I'm describing here. They probably will not happen so often, but just to keep it in mind. All the time, maintain respectful manner of interaction, no matter what they are saying, no matter how they are yelling at you. They may use all kind of abusive language. You need to remain respectful, because you.
Quick question. You haven't mentioned weapons. This is a weapon scene. Is that a 911?
I would think so, right? I mean, if someone shows up with a weapon, that's kind of a deal breaker, right?
If the person has a weapon,
Right.
if they pull like a knife or a gun,
The nearest door is there.
well, yeah, it's a totally different training for a person that has a gun and maybe going to start shooting people around. But yeah, you need to get away immediately. Or if you see a knife, or if you just see them reaching in their pockets, just be aware, and you may tell them to stop, or depending on the situation, there can be so many different scenarios, and you see them reaching for their pocket, but they're not so escalated. You may even directly ask them, if they carry something, just to clarify.
There's a good chance that if these are folks who are living on the street, they will have a weapon. So the question is not whether or not they have it or you see it, but especially as Svetlana is saying, is are they reaching for it? Are they brandishing it? Are they threatening? Because these folks have learned to survive and to protect themselves. So
Yeah.
chances are they're going to have something to protect themselves with.
The policy for the shelter that we have, and the ones that we have worked on with Reverend Marshall include that no weapons are allowed at the shelter, and if they do have something
Yeah, it's not taken from them, it's held for them.
held for them.
Right.
Yes, Yeah.
Yeah,
So, and then they sign an agreement
Yeah.
to be able to stay overnight with some of the agreements. That they have, if they have any weapons,
Mhm.
those then are. held
Yeah.
overnight. And they get them back.
Well-
And to my knowledge, that has never happened.
Yeah. So eye contact, look at them, keep attention on them. If they make you feel uncomfortable, because they may really, there are some people that stare at you, they may be mentally ill and they may feel uncomfortable. Look right here between their eyes, it will like lower this feeling of, this that they give you by staring at you. You can look between their eyes, but otherwise, if they don't make you uncomfortable, normal eye contact, then
Of that too, because sometimes it can be very, you can make them agitated by looking at them.
yes, if you are depending, if you stare at them, you need to be very relaxed, and this eye contact needs to be very calm, and you will, use your head to know that you listen to them. So, but yeah, if you stare at them, that may escalate them. So, but if you look just aside, they may feel ignored and not listened to. Body position, probably you've already heard that it's better to be like angled, not standing straight toward them, because it's a very unstable position. They can easily not push you and you can fall. And also this is giving yourself not only more stability, but giving them a sense that they have an exit. This may give them a sense that you are blocking them. If I stand like this, how do you feel versus this, right? This gives you like a sense that you can get away. Hand positions, in prison, they were teaching us, just keep them like this, relaxed, but you always can use them immediately to defend yourself. And they were teaching us to use a pen here on our badges. It's a weapon. I can hurt someone, not badly to kill them, but if someone is attacking me, I will try to hurt them with this pen, right? So it's just a tip.
I have a quick question.
Yes.
It would seem to me that you're bringing this up, not making dominance gestures, which is turning what's called quartering, what you just did, and then not staring, not being aggressive. What about inviting them to sit down?
Yeah, we'll
sorry.
get there. We have those.
You're straight, man.
Yes.
There's more slides.
Sorry, there are more slides, but so okay. Then let's see. Introduce yourself. Use tell them your name. Use their name. However, sometimes it's better to use their first name, but sometimes let's say homeless people that have not heard anybody calling them Miss Kirilova for a long time, and you call them Miss Kirilova, and so like using my name right now as an example, it may sound very good to them. So see how they prefer. You may ask them what they prefer, but sometimes you may approach them intentionally with Miss or Mr. Just to give them this feeling that there's important, right? There's something more than hating they are. So it can give you like a chance to de-escalate them. We talked about some of those. Don't react, don't take anything personal, don't raise your voice, don't argue, don't convince them, don't prove your point. Again, the angry person is not interested in your opinion, in solving their problems. At the moment you may tell them that is the something that will solve the problem. They're not interested. All they're interested in for you to hear them and what they want to say. So that's why don't try to argue or offer them solutions. When you de-escalate them, then you can offer solutions. Don't rush the person to talk because this can make them more nervous or that they can escalate. However, you may actually encourage them to talk more if you have some suspicious, does this person have hallucinations? They may not tell you something. I hear voices, I see something, but something's wrong. You feel that something doesn't make sense. You may encourage them to talk more. And if they mention, I'll go to this, if someone, but we actually don't have much time, how you actually try to de-escalate person with mental health symptoms. But if someone's having hallucination, ask them, explore. Do they hear something? Do they see something? And if they hear voices, ask them, are the voices instructing them to do something? Because very often the voices are instructing them to hurt other people or themselves. You encourage them to talk. But if the person is over talking or in a manic state and they cannot stop talking and they're jumping from one thing to another, it can go for hours. You need to kind of stop them and redirect them calmly, firmly but calmly. So you need to validate their feelings at the moment. Sorry, you can invite them to sit down. You can ask them, this was your question, right? To sit down to help them de-escalate. And depending on the situation, if you are getting to the point of closer and closer to the rage, you may need to tell them, sit down, right? You don't need to yell at them, but if they are not to this intense point, you can just invite them to sit and say, let's sit down and we'll continue talking. You may offer them a cup of tea, cup of water, coffee, if it's decaf, yeah, but if it's like a coffee with caffeine, not decaf coffee, I would say don't offer them something with caffeine. It can actually escalate them because they may be already taking some substances or caffeine. Before that, it make them more restless and escalate them. So you can offer them a snack or something. Let's say it's not there in the shelter, it's not lunchtime or anything else. But if they're hungry, they may be more irritable, right? Offer them something and this can help them to de-escalate. Give them opportunity. That's a very, very important skill. Give them opportunity to save face. No matter what they are saying, no matter what they're explaining to you, doesn't matter that you can see they're very manipulative. Some people are very manipulative and they're, doing and saying stuff. Give them a chance to save face, because if you don't, they may feel internal shame, they may not, but this will trigger more escalation if you don't give them a chance to save face. They will give you some kind of explanation. Just take it and don't show them that, oh, I know what's behind this. It's not that what you're saying, right? use
So-
humor.
This is not a place, is this a place where you'd say, it's okay, don't worry about it,
uh,
in terms of the saving face?
If they apologize for something, yeah, you can, yeah, definitely you can say, because sometimes they may start apologizing, especially when they go to, and they de-escalate and the intensity of the feeling is, decreasing. They may start even feel guilty or say something or look, and you can say, yeah, don't worry. I think everything's fine, everything's okay, right? Use humor, not sarcasm. Set clear, firm limitations through expectations. Some people de-escalate when you set firm rules and expectations, but some of them have never learned any boundaries. Anyway, you need at some point when you feel that they're crossing some lines to give them clear, but those expectations and those directions need to be very clear, short, very simple, and in a calm manner given to them. Offer them choices. You can come here tomorrow morning to check if we have a space for the shelter. We are signing up between 9 a.m. and 10 p.m. Let's say at 10 a.m. You can come tomorrow morning, or you can come another day, and we can find a space for you. But it happens in the morning, so, or you can. It's time for them to sleep. Someone is restless, making more noise, moving around. You can give them still a choice. You have 5 minutes to go to the restroom, again, take some water, or you can stay 10 minutes here, take a cup of tea, another cup of warm tea, and go to bed. So some kind of choice, although it's the same thing, 5 minutes or 10 minutes, it's the same thing, but you're still giving them some choice. Ask person to do something versus giving them an order, except when you're using control tactics as, sir, you need to leave now, or sir, sit down, sit down, sit down, right? Those are control tactics, but if there's no need of control tactics, then you can ask, like, let's go and sit. Do me a favor, go and grab 2 sodas from there and come here, and we will continue talking. So we can drink some soda and talk. And here's the sit down part that you were talking about. So I didn't have time to talk about the symptoms and how can you recognize that someone is hallucinating, someone is delusional or paranoid, but I want to mention hallucinations could be auditory, visual, olfactory, smelling things that are not here, or have distorted smell. Some people, believe me or not, I had a patient like this, may smell the normal food like feces, like spit, like chemicals, and they believe that people are contaminating their food or trying to poison them. Some people, we have someone in a bottle that we deal 911 calls often because he smells cigarettes all the time around his apartment, and he thinks everybody intentionally goes there, smokes, and to make him feel sick. So those are olfactory. If someone is complaining too much and or say that this smells like the S word, SH word, or urine or something else, keep in mind it could feel the olfactory hallucinations. Tactile, people feel that bugs are crawling under their skin, and even if they don't tell you anything, but you see those little wounds on their skin when you pick up the skin, and it's not the those signs of the needles on your blood vessels when they are using, but see those stuff when we're picking the skin, it could be. So we can encourage them to talk and explore. The hallucinations could be visual. Never, rule number one, if a person is delusional, which means they have false beliefs of what's going on, and the hallucination is a false perception. So never ever challenge their delusions or hallucinations. For you, it's not a reality, but for them, it's actually, they really experience, they really hear and see stuff. It's their brain that's doing the trick, but for them, it's real. So you neither challenge and tell them, oh, that's not true. You neither confirm that they're delusions or hallucinations. Then what do, right? You may tell them, I don't see what you see. I don't see the cat here or this person that you are describing, but I believe that you do, because they really do see the person. Or I can't hear anything that you say, but I believe that you do. And this can be very stressful, and going from there, you can continue the conversation. This must be very stressful and very frustrating when they have hallucinations, or especially. So, and you can tell them, you can let them to tell you how do they feel, what's usually helping you when this is going on, what's usually helping. So you can explore their coping skills, but don't challenge them, don't tell them, don't argue them, don't try to, if they're delusional, which means they may think that FBI or CIA are in kind of conspiracy or aliens, and the aliens now took over the Vatican and they now are controlling your church. And
No, that's true.
and the demon is communicating with the pastor, and then the pastor is passing the demons over them, stuff like this. You don't argue and you don't debate with them. Oh, that's not true. They are so great people. There's no demon there. Don't communicate with aliens. That's useless. But you can show, you can validate what they're going through, their emotions, the difficulties, the overwhelming experience of having this in your life, experiencing this. You can tell them because it's their experience, right? You're not saying something that is not true. You can redirect them. You can try to redirect and pull them to focus on a reality that they're in the church, they're talking to and other stuff, but don't challenge. Disorganized thinking and behaviors. You can see people doing bizarre, movements, talking or going like this in a particular pattern, compulsive, like walking. Never interrupt. If someone is going in a particular pattern, they make 2 steps here, they stop, they turn, they go 45 degrees, they do something, then they turn, they do a circle, whatever. I'm just giving you an example of something that I've seen. Never go in this space, never stop them, interact them, because you can really frighten them and escalate them very much, and they can attack you. You can gently, if you need, to communicate with them. Of course, if they're in the shelter and starting doing this and everybody's looking around, you need to find a way to kind of, maybe you can just ask for the DCR or whatever is the protocol for people to come and assess them. And you may not want even to interrupt this pattern until the help arrives and let the professionals help handle the situation, because if you interrupt this, it can really finish with something not so pleasant for them and for you. They may talking constantly, over talking, then they may be in a mania state when people cannot stop talking. They may not be in mania and still over talking because they have some personality disorders going on. You need to stop them at some point again. Do this do this with respect, try to redirect. And if the person is in a mania, full-blown mania, which I was going to talk about a little bit more how mania looks, but if you see someone with high level of energy, restless, they usually don't sleep for nights, they're very irritable, they're very aggressive and like verbally, or they will be stepping in your space and they will not stop talking for hours and going and jumping from one thought to another. You may not be able to manage this, and but you can just gently start redirecting and then maybe ask for help and evaluation, because this person may need to go to a hospital. People in depression, if you when we talk about depression, we usually, I'm over the time, right? Can you give me 5 more minutes until we finish?
Yeah, we want to make sure we have some time for some questions at the end too, so
Yeah.
we'll incorporate that.
Yeah, if you see someone in depression, depression doesn't mean that people will always be sad or just lying down. Depressed people can be really irritable and verbally aggressive. So use empathy, listening, reassure them, validate feelings. But people with let's say, oh goodness, suddenly the diagnosis disappeared from my head. Autistic people, people with those kind of impairments, the empathy, and it doesn't work because they cannot relate to the empathy, but to the particular rules and very simple rules and expectations that we can give them and directions. Intoxicated people, let them vent, use calm tone of voice. If they are escalating and if they're amping up, they may be in a delirium state. And if you go later when you receive the slides, you can go yourself through the,
You did it. I don't even know.
no. Yeah, I need to go. You can see everything explained what the delirium looks like. If you go a little bit further back, you can read about how the mood episode look like, what are the symptoms of hallucinations, what is delusion, how to recognize delusion, paranoia, and then the mood symptoms, and then you can read about the delirium. But basically, if the person is intoxicated, or they have used just recently some drugs, they may be in a delirium state, even if they are in withdrawal state. And if they start amping up or hitting, throwing stuff, you need to, if you suspect substance use, I would say call 911, because they may very likely be in a delirium state, and it's extremely dangerous for everybody around. Okay, I'm so sorry that it was Yeah, long, it needs more time for us to go in more details. I had
Thank you
this,
for doing your best you could with the limited time.
yeah,
It's so fascinating.
had this
Thank you.
idea to give you more information about symptoms and stuff to recognize them, but you can read about them, and now I will give time for questions, and maybe if someone from the the other.
First of all, thank you. There was a lot of good information, and a lot that's included on the slides there, and I have your email addresses. I'll make sure that you all get that. And the PowerPoint also has your contact information, both your email and your phone, so you can certainly contact you directly.
Yeah, you can call, leave me a message, give
Or
me a
call 988.
phone number, and I'll get back to you. And we can discuss over the phone if you have a question. And in the future, if you think we can make another meeting for an hour, I can within an hour go, especially with the mental health symptoms and how to communicate with person that is in mental health crisis.
If you do the next one, can we do role play?
Yeah, we can do. And I was talking to you, if they have already experienced, we can analyze what happened and see how this could be done differently, or what worked, what didn't.
Yeah, and that's a good segue to, we have on the Zoom, Pastor Kelly Domino, who is at Ronald United Methodist Church.
Not anymore.
No,
Oh, we lost him 3 minutes ago.
I'm so sorry that I went a little bit beyond my really so many things, that the topic is so huge that I
This is
kind
when
of,
we tell you, don't worry about it, it's okay.
yes.
Thank you.
I think doing another session where there's role playing is a great idea.
Oh,
Yeah.
yeah, I'd be happy to host it. We can get a bigger room if you need a bigger room. Yeah.
It does really well as a crazy man or a drunk person, it does really well.
Oh,
You have this, artistic skill.
that's great. We can, yeah.
What's a compliment?
I even told that we might have time today for scenarios. I was so naive to think that I could kind of squeeze it in 1 hour and have 30 minutes for scenarios, but it didn't happen.
Are there any final questions for Svetlana? And maybe you'll stay for a couple of minutes afterwards. Thank you very much. Thanks again to the community, the meal volunteers who work every
Tuesday night. Yeah.
And to our shelter volunteers.
Yes, thank you all
Thank you, Svetlana.
very,
Appreciate it.
very much.
Thank you.